So the session is on life course immunization, a futuristic approach to public health. So now, whether we are from public health domain or not, COVID brought all of us to a very fair understanding of immunization. And the larger discussion, today here is about extending the benefits of vaccination from childhood throughout the entire lifespan, as that seems an increasingly urgent point or a priority point in the view of the world, in the view of world's transitioning population, emergence, and re-emergence of, in fact, the infectious diseases. Now, with this critical knowing, I take this opportunity to introduce our esteemed panel of expert speakers who are here today. And this is like a panel that I have today. These are the experts who are playing a pivotal role in essentially shaping the public health discourse in the country today. So I have with me Dr. K. Madan Gopal. He is the Senior Consultant of Health Niti at Niti Aayog. Dr. Raj Shankar Ghosh, he is the Senior Consultant of Immunization, South Asia Path. Dr. Satyavrata Rotre, he is the Director of Infectious Diseases at Path. Dr. Santosh Kaur, he is the Director of Medical Affairs, Vaccine Pfizer India. Dr. Pankaj Bhardwaj, he is the Additional Professor of Community and Family Medicine at AIIMS Jodhpur. And last but absolutely not the least, I have with me Dr. Madhu Gupta. She's the Professor of Community Medicine at School of Public Health, PGI, Chandigarh. Thank you, first of all, to all of you for, really sparing, your valuable time this morning and joining us for this discussion. Rather, a very critical discussion at this point in our today where we are, in the entire public health discourse in our country. And as we begin our today's conversation, I'm going to, take the opportunity of moving to the lady speaker who we have, amongst all the men here today. But not only because of the gender, but also because, ma'am, let us, begin with understanding basically, what essentially is life course immunization is and what impact it essentially has on the, public health and the disease prevention. And this question is essentially, it might sound simple to, the experts here, but, the larger audience who has with us, I think we need to set a context to help everyone understand basically what that is. And so that, we can move towards a more nuanced conversation in our discussion today. Over to you, ma'am. Thank you.
Thank you, Dr. Nalini. I hope I'm audible.
Absolutely. Perfect.
Yeah. So at the outset, I'm grateful to the organizers for inviting me here and actually having a panel discussion on such a important topic. And I'm grateful that I am amongst the August panelists here. So who definitely have a greater experience than me, and I'm looking forward to learn as well. So as far as my understanding goes, so there are definitions of life course immunization. So life course immunization, it's an approach wherein you are basically focusing on providing schedules and access to vaccine as per the people's need across all age groups. So we are here focusing on providing immunization schedules and access to vaccines as per the need of that population group across all age groups. So herein we start from childhood vaccination, then we move on to school going age group, including then adolescents. Then in the adults, we have pregnant women, travelers, healthcare providers who are more at risk of getting the infection, and the older adults. So that completes the life course immunization approach. And why it is important? You see that we are our focus, like as a country, had been on childhood immunization because the mortality because of infectious diseases was very high in this age group, but it was also higher in the elderly age group. We are moving towards a concept of healthy aging, and the vaccines which we give in childhood age, the vaccines, they do not have a lifelong immunity. The antibodies wane off, and also as previous speakers were speaking, there is immunosenescence, that the immune system also ages with time. So that we need to compensate. If the system has to compensate that, and that's preventable. That's very important. Yeah. If it is preventable, it is affecting the morbidity and mortality, then why shouldn't we? So, I mean, there is definitely a need to focus to provide life course immunization to prevent infectious diseases. Now look at this diphtheria, pertussis, and measles. They're coming in adult age group. So their reasons are many. If like vaccination coverage could be poor, and there are susceptibles who then become adults and they get infected, or the vaccine is coverage is very high, and then the organism do not get to see the children for infection, and they infect the adults, and also the waning immunity. So these are the reasons that the adults remain susceptible, especially the older adults. So that is, I think, that is why the approach life course immunization is very, very relevant in this context. And as a country, I think with COVID-19 vaccination, we could implement adult vaccination. We have that experience, so definitely we can move towards that.
Absolutely. Thank you, Dr. Madhu Gupta, for, setting the context and helping us, really understand, in a very, very simplistic manner. And I'm sure, the audience also watching here, I mean, they could relate to, what this entire concept of, life course immunization is. And moving on to, a similar tangent of what we are talking right now to Dr. Pankaj Bhardwaj. So we have heard from ma'am that what exactly is life course immunization, and in India also, if we currently look at, in a programmatic level, what's happening, at the moment, the immunization against vaccine preventable disease has largely been, focused on very specific groups to a very large extent, which is, young children and, infants. However, now there is another entire set of vulnerable population which is sort of left behind, right? And which might also some include, sometimes elderly women and elderly people and pregnant women and, similar, high risk, population groups, so to say. At the same time, now, when we look at the global policies, we have WHO with the entire, global policy frameworks, etc., on healthy aging, etc. So if we look at, within the Indian context and the way the population is also transitioning, can you help us reflect on, life course immunization and its sort of perspective on, the transitioning population, how the idea at a programmatic level needs to be expanded, right? And how do we fit in healthy aging for our country also within this? And maybe if you could also help us, reflect on what government needs to do on that particular front.
Oh, thank you so much, Dr. Nalini. Hope I am audible.
Absolutely perfect.
Yeah,
Go
so
ahead.
thank you so much, and thank you, Madhu madam, for setting the context, because that is very important. And I
Yeah.
think when she said about life course immunization, I will echo on all the points which she said. Just to add to few is that when we say life course immunization, so we should understand that life course immunization is to address the lifetime risk, and that is the basic point that we need to understand, that this immunosenescence, which madam has definitely point out, and the earlier speakers were talking about, it is not just the immunosenescence. Actually, the presence of low-grade pro-inflammatory status, and we call that as inflammaging. This inflammaging results in accelerating aging. So we need to understand that this senescence has another angle, which we call by the name of inflammaging, and that actually accelerates aging. As you said, Nalini, that this is about healthy aging. Unfortunately, in India or in rest of the world, we are actually working with the Swedish ministry also. We are not currently having the even indicators of healthy aging. So it's very difficult currently even to define what healthy aging is all about. It is just to be out of morbidity or mortality, or to have a
Yeah.
good quality of life also. So in a country like ours, where routine immunization is again, it's been set in a good way, but it's not been 100%. So how can we define in those age groups where we just say that we are 8% population of country is aged? So that, that's the problem which currently India, or currently the people like us are facing. So now I will also come to a very important point, that it's the time when this life course immunization, when we talk about this, is that with this approach we will be able to reduce morbidity and mortality and caused by these communicable diseases, as well as some down what we call as down stream effects. And I will again give them a condition which is known as immune fitness. What is this immune fitness? This immune fitness is more about immune plasticity and resilience. So what does that mean? It means when there is an external threat to us, being aged, as you said, if we are vulnerable, we are having an age which is more than 45 years of age and comorbidities, then if there is an external stimulus to my immune system should be able to react or respond to that positively. But when that threat is over, I should get back to a homeostasis stage. And I think that is very important, as Madam said, that the immunity wanes off. And if immunity wanes off, the only way to resume immunity is to have these important vaccines, which are actually applicable on VPDs or vaccine preventable diseases. To tell you the truth, there are a lot of stories, lot of science, and lot of published article which says that, for example, for influenza vaccine, this is not just pneumonia, cardiovascular, cerebrovascular morbidities, which happens is actually taking, good quality of life of an individual. So, as you very rightly mentioned, that life course immunization not only takes a kind of a severity, but it has kind of a parallel effects on building the immunity to have a better healthy or better aging process for us. As you said, what is the what government of India can say? I'll say again the same principle which our earlier speakers were talking: accessibility, affordability, infrastructure, and reimbursement. I'll say only 4 points that we need to work on these accessibility, because we need to know. I know that all of us will agree that for children, we know that these are pediatricians who will provide the vaccination to these, but we don't know actually who will provide the vaccination or immunization to adults. So this is about accessibility. Number two is affordability. We have our pharmaceutical companies with us, so how would it be affordable? Infrastructure, as I said, these immunization clinics. And last but not the least, if suppose I'm taking it, would my these insurance company will help me out in taking a cost of that or reimbursement. So I think I could make my points clear on this. Thank you
Thank
so
you
much.
so much, Dr. Pankaj. And I mean, I think everything that you said, it was great in, from the transitioning population perspective, from aging perspective, and then, of course, at a more programmatic level of, what the government can also do. And I'm certainly going to, circle back to both of you again, as I do have many follow-up questions on that. But, taking cue from actually what, with the point with which you ended, your conversation, I'm going to bring in Dr. Raj Shankar and also Dr. Satyavrata Rotre, because having seeing both of you on my screen today, I cannot help but ask prick your in fact brains today on the implementation side, because both of you have seen the transitions of the how universal immunization program has sort of was rolled in the country. You've seen the journey of such programs to a very great extent, and not just from what the government is trying to do, but also from the implementation perspective. Dr. Raj, I'm going to begin with you. That first of all, please help us understand that we are here talking about life course immunization, a perspective which we are still developing. It is still not laid out in a very structured form. Even in the government programs, we do not have it yet. While in some shape and form there are certain we have certain programs under different immunization, and the idea is still growing in our country. Therefore, from implementation perspective, where have we been with all the immunization programs where we have rolled out in the country so far? And if we have to sort of implement now this larger aim of life course immunization, like Dr. Pankaj said, accessibility, affordability, infrastructure, insurance, I mean, this entire paradigm shift needs to be done. So where do you think, are we ready as a country? And if not, what has our journey been, and what can we learn? Where can we move from here? I know it's a heavy
Wonderful.
question,
Thank you
but
so much.
I cannot, sort of not take the advantage of your experience in this space.
Thank you so much. So, first of all, I'd really like to thank the organizers for inviting me to this conversation. It's a real honor to be part of this very well opportunity to tell people that I work in media. The sense of pride that I have in saying that because India's immunization program is considered globally today by all the different levels of public health people and also by general people as one of the most efficiently run programs in the world. We have done that, in terms of our routine immunization. Many of the models that we have developed in the country are being followed in different countries of the world in terms of ensuring that we have an uninterrupted supply of vaccines, not only in India but also for other low and middle income countries through platforms like UNICEF, Gavi. We have done it, and the third area that we have done is that the sheer numbers that we have been able to vaccinate through our various campaigns, the Mission Indradhanush, the Pulse Polio programs, the measles elimination program, and also recently during the COVID vaccination program, speaks volumes of the efficiency of our program. Now, when I say that, I am very optimistic about the immunization programs that the country has adopted and will sustain and will adopt in the future about the life course immunization that we are talking about today. If we see India, India works on the principle of 5 E's in terms of the immunization program. The first we talked about efficiency. For a very long period of time, our healthcare workers, our program managers have been super efficient in terms of delivering the vaccine at the last mile. The second part of the E is around the evidence. All the new vaccines that have been introduced, all the new programs that have been introduced, for example, the Mission Indradhanush, and then its journey into the intensified Mission Indradhanush, all of these have been based on solid public health evidence. The third E that we have talked about is in terms of the empowerment. While we have done the program, we have also taken steps to empower our health workers through the regular trainings and different kinds of orientations that we have done for our program managers. And also very recently during the COVID vaccine, the digital applications that were brought in, like COVID, where for the first time probably in the world, a person was empowered to make a decision as to the time, the place, the choice of the vaccine that the person could take in order to protect her or his life. The fourth E that we talk about is about the issue of the empathy that we are slowly developing towards our population in terms of the vaccination program in the Northeast, where for a very long period we had a very low coverage in the states and in the far-flung areas. There are very serious attempts, and I know there'll be some time to discuss this, where community-based organizations are working very closely with the community to understand their needs, their convenience, their issues in order to design programs and deliveries based on their needs. Now, having said all of this, India is now committed to introduce the second, phase of the vaccination for HPV vaccine in the adolescent group. Why I say second? Because India has already demonstrated in Sikkim and in parts of Punjab the introduction of the vaccine, HPV vaccine, which has been a very successful program in Sikkim. And based on those lessons that we have learned, we are going to take the next step very soon about including that vaccine in the universal immunization program. India is also considering to vaccinate the adult vaccines, and those will come in different steps of time. As I said, introduction of a vaccine is a process that must be backed by solid evidence. India has now the evidence for the diseases that can be prevented in the adults and through vaccination. It also requires a lot of the prioritization of the various activities that needs to be done. All of those are in place. So, in a nutshell, I would say that I am very optimistic because the DNA of India's immunization program lies on the different E's that I talked about. And with that, we don't see any reason why we should fail in that.
Thank you so much, Dr. Raj. And I see a lot of optimism as you explained, the entire if I could say, the demand and side and the supply chain side, and you talked about doctors, the infrastructure, service delivery, everything that you said, was very optimistic. And
One
yes.
point, if I may add, just one point. You know, why I am very optimistic. I am always very optimistic because of our manufacturers who have really committed to supply uninterrupted supply. But what makes me more optimistic is the very recent UNICEF State of the World Children report that has come out. And if you see, India has the highest score amongst the confidence on vaccines amongst the population. 98% of India's population believe that vaccines work. And there can be no better kind of indicator with an uninterrupted supply, with a huge demand for vaccines, why we should fail. This has not been the work of any government or of any institution. It has been the hard work of our healthcare workers who actually are the most trusted kind of health personnel by the community. And if that stands, then we can never fail in immunization.
Thank you so much, Dr. Raj. And I think everything that you have said, I have a follow-up question there. And because,
Sure.
in the interest of time, I'm going to like refrain myself, but definitely I'm going to come back to you for certain
For
questions
sure.
on that, at that, level. Dr. Rodri, I'm going to move to you, and the same question to you. And Dr. Raj seemed very optimistic on that front. A devil's advocate I'm going to play here. Do you agree with him? Because I have a follow-up question, because when we are talking about, the infrastructure here and everything, I completely agree that the vaccine confidence sort of thing that we see is really great when we look at India, because our government has invested quite a bit in behavioral communication and the change programs as well, which are very important for, the adoption of, vaccines that other health solutions the government is sort of introducing. But if I look at service delivery, my first question to you is that, whether you agree with Dr. Raj and your take on all of that I was asking before. But also then, if we are so optimistic, then my question is that, when we look at the storage and transportation, um, there are sort of loopholes, because the vaccines, they are not only confined to the metro cities and larger cities. They have to go from one city to a tier 2, tier 3, and to the last mile. How the storage is happening, how the transportation is happening. I also want to understand that, if we are talking about making India, this image for India in terms of life course immunization, given the kind of population we are, it's not an easy job to be done in our country. But if we are aiming like that, how important for us is also how important it is for us to also look at these kind of issues, the supply chain, transportation, storage, and all of that. And are there interventions that are imperative on that front, and what are those interventions?
Well, thank you very much for the question. And first of all, yes, I do agree what Dr. Raj has just told. We are the largest birth cohort, and immunization has been predominantly about the universal immunization program that has been well demonstrated, well executed with all the good things. And yes, I do agree. We have immense potential in terms of manufacturing as well as vaccine delivery, not among only children's, even beyond children's into life course, because COVID vaccination has demonstrated all that machinery, the well-oiled system that has delivered these vaccines so efficiently all across all age groups, that has been proven. Coming to the supply chain or the cold chain, yes, that's a very crucial, vital component of vaccines. It has to be maintained at certain temperatures. Cold chain is so very critical, and it's 2 to 8 degrees or sometimes sub-zero that we haven't yet introduced those vaccines yet. But the supply side is the hallmark of good vaccine delivery, and that has been in place. We have a massive cold chain system all across till the ground level. We have the central vaccine store, the regional vaccine store. There are transport mechanisms, and then we have these ILR points at the PSC block level, which is our last sort of a cold chain storage point. And beyond that, we have the cold boxes and vaccine carriers that deliver the vaccines to and fro from the vaccine session sites. And without that, it's just not possible to deliver such kind of a vaccine so efficiently that Dr. Raj has just mentioned about. And we have that capability.
Right. Thank you so much. Thank you to both of you for instilling again that, positive confidence that yes, we have it. And, the maybe the base work and, the groundwork of that has already been laid. What we as, different set of stakeholders now have to do is just, structure and put the entire big structure there and then look at, how we are moving at a programmatic and the implementation level. Thank you so much. And we have with us Dr. K. Madan Gopal. He is from Niti Aayog. Thank you so much, sir, for joining us. We have been talking about, we started the conversation today by understanding from two medical experts that we have that what exactly is life course immunization. We have two great experts from the development sector who have seen, the transition of the vaccine programs, implementation programs, in the country, and they told us, how, we are at the programmatic level and the implementation level. And now, my question to you is essentially, on the policy front that, when we look at, not only we are here talking about a generic immunization, we are essentially talking about a life course approach to immunization where we are expanding the stakeholder groups. Currently, what we see is, the immunization for vaccine preventable disease only localized, essentially localized to, specific stakeholder groups, which is, children and infants, right? Now we are talking about how do we expand it. In bits and pieces, we have already done in certain, forms, the thinking is there, but covering, the same thing at a very programmatic level is at a very nascent stage in our country. So from a policy perspective, where do you think, India stands, and where does, a concept like life course immunization, because of course, the increasing life expectancy of, vaccine preventable diseases is also becoming more critical. Where do you think, this particular concept contributes to the public health outcomes in our country? How it is shaping the entire discourse of achieving also the 2030 agenda and sustainable development goals is also helping our country. Would you?
Thank you, Dr. Nalini. This is a very pertinent question in the current scenario, because we have been focusing on mothers and children immunization. It has been all focused approach which is happening. Then during the COVID times, we have seen the uptake and use of immunization as a tool by the adults also. So a discourse has started that we should be having a life course approach for addressing the issues of immunization, because ultimately the aim of anybody, as we have traveled a long distance from disease to health to wellness, wellness to well-being, if you want, during this journey, whole of this journey, this life course immunization becomes very important, because for addressing the issue, for preventing the diseases and moving towards wellness and well-being, this immunization aspect becomes very important.
Yeah.
So lot of deliberations are happening. One more organization, they have deliberated and come up with a publication, how we can include that. Second thing, we have taken pride in the demographic dividend which we are having. We say that we are having the working population more, and this demographic dividend would be there for the last coming 1 or 2 decades. But simultaneously, what we are witnessing is the aging population, which used to be around 8%, now it would be around 12% if a census happens. And that projection is happening, and their requirement is very. Our whole system is geared to cater to the focus groups, as we have taken the approach of primary healthcare approach, and we have built a structure around that. The public health structure is built around that thing. And to address that, the challenges of the elderly, the challenges of elderly, that's a coming thing, then immunization could be a very cost-effective intervention for preventing the disease and other things. That's why this becomes important. That means right from child, from womb to tomb, that services which you usually talk during this PSM days, womb to tomb healthcare services. So that means the life course, right, starting from 0 dose of polio, BCG, to your pneumococcal vaccines during the continuous shots of pneumococcal vaccines during your old ages. So that kind of thing is required. Okay, at what age, what appropriate age that vaccines are required, and that the dialogue and that other things have been initiated, and work is in progress in that direction. And
Right.
and as we are progressing, as the more and more evidence is being generated, more dialogue is happening. Then obviously, looking at the other aspects, we do have a mechanism in which these things come into the national program. So
Right.
unless and until it comes to that level, that means we do have a national technical advice, a technical group on vaccination, NTEG we call, so
Right.
which usually allows that such and such vaccine can come into the system or not. But to reach that level, lot of things is required, evidences are required, dialogues are required, advocacy is required, and this kind of interaction is a step in that direction. That means advocacy is happening in that direction. So
Right.
lot of work is to be done, and it is work is in progress.
Right. Thank you so much, Dr. Madan. And Dr. Santosh, I'm going to move to you. And, we heard Dr. Madan, and the rest of our speakers, there's a sort of optimism around this entire, concept of life course immunization, and which is very justifiable, right? Because like Sir just, ended his conversation, and we heard, many other experts right now, they have actually given the case in points that why we are very positive, and why a lot of more successes can actually be achieved, right? Of course, understanding that we need a bit of more evidences, more concerted approach, dialogues, and maybe partnerships, etc. So from where you stand, from the stakeholder group that you represent, it's very critical from where you see this entire elephant and this particular problem. So what do you think, as moving on from here, how do you see the expansion and improvisation of uptake and promotion of this life course immunization as a concept? And and where do you think that all these stakeholders are they are playing a role, and how can all the stakeholders from your perspective can come together and play that role? So you're on mute. Could you please unmute yourself?
So thank you
Thank
so
you.
much, Nalini, for sharing that question. And it is quite reflective question, because when you talk about immunization, it is not a single stakeholder who will be able to achieve the impact. It is a multidisciplinary approach. And we have
Right.
seen, we are celebrating the World Immunization Week, where we are talking about the big catch up. And I would say that it's not only for infant, and we have taken the topic of life post immunization. Before I answer how each stakeholder will come into picture, and especially the stakeholder, the pharmaceutical industry that I represent, I would like to bring attention to one important aspect of immunization, which always gets under recognized. That is the impact of immunization on antimicrobial resistance. Today, we all know the pipeline for antimicrobial is drying up. If you look at the new antimicrobials which are in the development, as of 2021, there were almost 27 antimicrobials. If you apply a filter of WHO criteria of innovative antimicrobial agent, only 6 antimicrobials fit into the criteria of innovative antimicrobials. So most of the microbial agents are actually belonging to the same class, expanding some spectrum, but not addressing the need of the antimicrobial resistance. So when we are grappling with the challenges of rising antimicrobial resistance, naturally it comes to me being a physician also. I think that the best way of preventing antimicrobial resistance is the vaccination. So in any antimicrobial stewardship program where we focus on the infection prevention, surveillance, and many other pillars, I would say that we need to add one more pillar to our antimicrobial stewardship, which is the immunization as a pillar. And
Yeah.
the moment we achieve that, I think the replication and the ripple effect that it would have on the antimicrobial resistance problem and the challenge will be multifold. So
Right.
what I would say is that when we are focusing on the public-private partnership, and we have many examples,
Yeah.
and I really acknowledge and appreciate the efforts which have been put by the government to strengthen the healthcare delivery system in country. Today we have like Ayushman Bharat Healthcare Infrastructure Mission, because to deliver any immunization till the last mile, we have to have very strong infrastructure, and
Right.
that can only happen if you have laboratories which are empowered and strengthened, which can detect the diseases, especially the vaccine preventable diseases. And that will actually build confidence from different stakeholders, that how do we make the burden of BPDs aware, like maybe visible to the different stakeholders, right? From consumer patient to the healthcare providers to the policymakers and payers. We cannot really miss out on the payers, especially the insurers, who need to come forward and also start making innovative proposals uh, to incentivize people who have been taking the preventive care. So my quick summary would be that we have to focus more from shift our focus more from sickness to wellness. Okay, and this paradigm mindset change will only happen when we include preventive measure as one of the disease management. Currently, when we see any guideline on the disease management, it starts with the
Yeah.
pharmacotherapy. To some extent, we have lifestyle modification, but the preventive treatment, which is a vaccination, whether it is for heart failure, whether it is for COPD, whether it is for patients living with HIV, whether it is for sickle cell disease, it's not given the importance. I'm not saying it is not there, but it's not given the importance that this deserves.
Yeah.
Thanks.
Thank you so much, Dr. Santosh, and great, I mean, great inputs from you. And, like you said, about the preventive health, etc. And taking a cue exactly, from where you left and moving to our, two medical experts that we have here, Dr. Madhu Gupta and Dr. Pankaj. Um, we've heard all our speakers here today, and there's a great optimism, and for very fair reasons of, we have seen where the policy discourse is, where the implementation strategy is, where, the idea of different stakeholders coming together and building solutions are. I mean, we have a set of, groundwork there. But going back to, the again, more basic aspects of this entire conversation, which is essentially about, immunization, because these are very cost effective interventions, right? There are, non-specific benefits that are always attached. We have been talking a lot about, or which, when we say that there are evidences, essentially we look at, a lot of more specific benefits, but we have to broaden and see, a lot of non-specific benefits. And like Dr. Santosh, actually he added the, dynamic of EMR also here, right? So, from this entire framework of preventive health, it is really important to look at this entire, concept of life course immunization from a very broad perspective. So, as medical experts, what role do you think, medical community? Because, my question is also from the perspective that we have these, guidelines by IMA as well, which is a strategic sort of a roadmap for life course immunization, right? So, medical community play a really important role now when we have sort of a roadmap for life course immunization. The strategy is already in place, which is enforceable or non-enforceable is a very separate kind of a conversation. But to a very large extent, the medical community at large has at least recognized, right? So the first solution to a big problem always comes when we recognize that this is a problem and something needs to be done, and the initial steps have already been taken by the medical community. So if we sort of move here, and to take India towards that path of a holistic immunization program which encompasses the entire population, irrespective of their age groups. And also we are looking at, preventable cancers and hepatitis. There's so many, entire disease category that we're talking about here. What role do you think doctors can play more here, more active role that, they can play, in terms of preventable outcomes at the disease level? And where do you think, because we have private organization here, we have but they are giving huge solutions to us right now. We have people from the development sector who have great expertise from they're helping us implement from taking the policy to the last mile. And when I say they're taking the policy, they are actually giving that for a person who's sitting at the last mile. For them, taking the policy means that they are getting vaccinated. For them, that is how they see it. They don't understand perhaps, the technicalities of it. So there are people who are actually, enabling that for us. We have here people, who are making the policies are here with us. So within that entire, ecosystem, where do you see role of, doctors here, and what, more role that, you think, as experts you can also play? And what do we expect, as a doctor, what do you expect from these stakeholders who are sitting here?
Yeah, thank you, Nalini, for putting up that question. I think doctors play a crucial role. They are the very, very most important stakeholders because patient comes to them. Patients come to them for their treatment when they're sick. And if the doctor right there and then, this is your immunization schedule during adult or during older age group, they are going to follow it up. They are definitely, their compliance will be very, very high, because patient himself or herself has seen it, has experienced it, and they would not like to experience the same episode again. The compliance will be very high. So this is what we have also found in one of study. There's evidence that lack of awareness among the healthcare providers themselves. They are not sure what to write, what to prescribe, which vaccine to be given. They sometimes call us, like, I'm into public health. What vaccine is to be given? If there's a dog bite, even simple a dog bite, they will ask me, how should we manage? So, I mean, there is lot of gap here in this area. For childhood immunization, pediatricians know. I mean, they have their own protocols. IAP is there. Similar to IAP, we need to have physicians, schedule or physicians guidelines should be there for all the healthcare providers, which should be easily available. Or maybe from the government of India side, it has to be made available to all the medical officer, be at primary care level, secondary or tertiary care level. There is a need of definitely there is a big gap here, and there is a need to have it. Association of Physicians of India, they have their guidelines. They have a paper also. They have come out with the guidelines for adult immunization. But see, all these associations, they are giving their own set of recommendations, and these do not sometimes match with each other. Like Indian Association of Preventive and Social Medicine, they have also attempted, okay, these should be there. But from holistically point of view, from the government perspective, what is the most essential vaccine that should be given to the adults, or after 5 years of age, what should be given? So those guidelines, there's a need to have those guidelines. I think we have to think in a uniform, in a united way. Okay, for from childhood to the older adults, like during this life course immunization, what is the schedule? So I think that will solve the purpose, and definitely doctors can play a huge role in this. They can further train their nurses, their pharmacists, their healthcare workers, and healthcare workers are excellent. We have seen it with COVID-19. They are very good communicator with the community. They can do the behavior change communication in the community if they are given the right training and right messages. They are very good. I think we, as a country, we can definitely show that we will be able to implement it in a very efficient manner. So, and doctors are the key, as I've all told you, because patients trust them. So, and the message can go far, and not only in the public sector, but in the private sector also. And in the private sector also, there is a huge gap. I mean, doctors would not prescribe immunization or vaccine. So that is a big gap. Thank you.
Thank you, Dr. Madhugupta. And I think you've said, like, while we are concluding, our session now because of the paucity of time, and I think you've really set again the context for concluding, our conversation right now. Dr. Pankaj, the same question to you, and your concluding remarks first of all on that, and then the role of doctors and where are we? What more needs to be done?
So thank you so much. And in the interest of time, I also only two things. That one, which Madam has very rightly said, that the thing is that they can be the better advocates. One thing which I feel is that they can be the role models also. If any hospital writes this, that this is the hospital where each and every healthcare worker is vaccinated to his age, then it gives a kind of a good message to the community that yes, these doctors, nurses, paramedics, they are actually being vaccinated, and there is no chance of getting the hospital acquired infection. As number two is there, what we feel is that there should be a kind of a one-stop shop which is should be available in each hospital, where these patients can get a kind of an advice that if suppose they can afford, because again, as I said, that it's the issue of affordability when it comes to adult vaccination. But if they can afford that, these are the number of 1, 2, 3, 4 vaccines which is made available to them. And third, last message which should be given to all of them is that it's not if you are vaccinated and if I am vaccinated for my age, I'll not get severe infection. I'll not get, I have less probability of getting ICU admissions or hospitalization. And that way I will also save my care providers. That means I will also be a kind of an indirect benefit to my own family members, where we are not just talking about me, I'm also talking about who will take care of me if I'm hospitalized at ICU. So
Right.
that is the 3 points which I would like to add to what Dr. Gupta has
Absolutely.
just
And
mentioned.
brilliant points, Dr. Pankaj here. And in the interest of time, I'm moving to all our other speakers. Again, we've heard our doctors and they are making like some really critical points of, how can we have, more, sort of common guidelines and programs and, which are more enforceable and all of that. We can have role model hospitals there and all of that. Right, because these are certain aspect that really help in again when we were talking about evidences, we were talking about having the right now solution oriented approach involving more technology here. I mean the list is endless, and government has actually done in bits and pieces all of this, and COVID was a great example for us that how delivery it was integrated with technology, it was integrated all the means and measures that we could have taken. But in the interest of time, my question again, to all of you, that your concluding remarks of we have already understood that where we are, but what is the way forward from your Dr. Madan? We'll start with you.
Dr. Nalini, as I mentioned earlier, this is the work is in progress. So a lot of discussions are going around this thing, and it needs to get institutionalized before some policy level decisions can come. So a lot of work is going on. So I congratulate you that you have taken up this subject and see that you take it to the next level and see how the deliberations and other things which you bring out, they at least influence the policy level decisions which would eventually come in a due course of time. Let's see that how we progress and how things shape up and evolve. I will only say this much at this moment of time. Thank you.
Thank you, sir. Dr. Rotri, over to you.
Yeah, I
Quick
think
points from you.
yeah, it's very well said that vaccines are the greatest tools to control diseases, prevent outbreaks, and it can lead to healthy aging and all those things. So it needs a lot of awareness among the community to understand the cost benefit and the specific protective role that vaccines play, including AMR reduction, including outbreak and reducing mortality, morbidity. And doctors are definitely one of those greatest advocates that the community listens to and the key opinion leaders.
Thank you so much, Dr. Rotri. Dr. Raj, over to you.
Yeah, I just echo what Dr. Madan Gopal and Dr. Rautre said, that this has been a fantastic conversation. I'm really thankful for bringing up the issue of AMR into this conversation. I'm very thankful for the points that Dr. Madhu Gupta made about the advocacy, the need for our doctors becoming advocates. The only thing that I wanted to also say is that for the government, it is to create an environment where a very robust immunization program can be carried out. But it is also about the private sector, the small, community-based organizations, the common people, to really work on this together. It is not the government's job to, ensure that there is 100% immunization. It is the job of every citizen of India to ensure that. And there are a lot of activities that are happening in the very far-flung areas. One of the issues that Dr. Bharadwaj mentioned was that, we have had great coverage, but then there are still pockets left out. Yes, there are pockets left out, and those are being addressed by various small level NGOs. Today, I cannot illustrate the example for the paucity of time, but I'm sure that, we are moving in the very right direction towards it.
Thank you so much, Dr. Raj. And last but not least, I'm going to move to Dr. Santosh. Over to you. And like you have raised a very critical point, and I think we could actually go on to that conversation for another half an hour. But in the interest of time, we've heard, different stakeholders, and they've actually pointed very, very relevant points that yes, that there's a really great work that has been done, but now idea is to sort of, sort of step up, create that ecosystem, their environment, robust,
Probably there is no.
right? But again, in your perspective, what is that way forward, and what would be your concluding remarks?
So I just have two thoughts to leave this forum. One is we have to address vaccine hesitancy at each level possible, and one of the priority could be elevating the health literacy in the country. And second thought is we have to solve for vaccine equity through
Yeah.
public-private partnership where we share our expertise, efficiency, and technology And through this, we can build the surveillance, not only to show the burden of disease, but also to show the impact of vaccination, which is somewhere is the large area of improvement for us, more so on the economic as well as the humanistic front. Thank you.
Thank you so much. And with this, we can come to the, close of our session today, this great session. And I can't help but thank, with all my heart to all of you. This was one very informative session. And, how I see is that, you all just converted this knowledge of so many years that you've gained, not just, it's a theoretical knowledge, it is what the evidences that you've seen and helped us understand that, it's a, and like I was pointing to Dr. Raj that, just helping us create that optimism that we have done great work. And what we really need to do now is build more evidences, come together as experts from different stakeholder groups, and just move in a very organized manner, for a common goal here, and see much better results for our country, here on. Thank you so much.